Sidang hadirin dipersilakan duduk. Saya mohon untuk menanggalkan pelitup muka. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Yang berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali, yang berbahagia Profesor Dato Dr. Hanafiah Harun Rashid, Pro-Naik Canselor UKM Kampus Kuala Lumpur, yang berusaha Profesor Madya Dr. Jamari Sapuan, Timbalan Pengarah Perkhidmatan Surgery, Wakil Pengarah Hospital Canselor Tuanku Muhriz, yang berusaha Encik Mursidi Ahmad, Timbalan Pendaftar Hospital Canselor Tuanku Muhriz, ketua-ketua jabatan, pegawai-pegawai kanan Kampus Kuala Lumpur, sidang hadirin yang dihormati sekalian. Bersyukur kehadirat Allah Subhanahu Wa Taala, dengan izin dan rahmatnya dapat kita bertemu di majlis yang penuh bermakna sempena sambutan Jubli Perak 25 tahun HCTM, iaitu Syarahan Kepimpinan Hospital Canselor Tuanku Muhriz Siri kedua, yang akan disiarkan secara langsung di Facebook HCTM dan HCTM TV. Majlis merakamkan sekalung penghargaan terima kasih di atas kehadiran yang berbahagia Pro-Naik Canselor UKM Kampus Kuala Lumpur dan Div-Div kehormat serta hadirin yang turut bersama-sama pada pagi ini. Majlis turut mengalukan kehadiran tetamu istimewa kita yang sudi meluangkan masa untuk berkongsi ilmu dan kepakarannya dalam Syarahan Kepimpinan HCTM Siri kedua, iaitu yang berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali, mantan Dekan Fakulti Perubatan dan Pengarah Pusat Perubatan UKM pada tahun 2011 hingga 2016. Majlis merakamkan ucapan penghargaan terima kasih dan selamat datang yang berbahagia Profesor Emeritus Dato. Hadirin sekalian, kita berikan satu tepukan penghargaan buat yang berbahagia Profesor Emeritus Dato. Bagi memberkati majlis, dipersilakan Al-Fadil Ustaz Hasrizal Hasan, Pegawai Hal Ehwal Islam Pusat Islam Kampus Kuala Lumpur, untuk memimpin bacaan doa. Dipersilakan.
إلى حضر النبي محمد صلى الله عليه وسلم وإلى كافة الأنبياء والمرسلين وآله وأصحابه. الشيء لله لهم الفاتحة. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وأصحابه أجمعين. اللهم اجعل جمعنا هذا جمعا مرحوما، وتفرقنا من بعده تفرقا معصوما، ولا تجعل اللهم فينا ولا معنا ولا حولنا شقيا ولا مطرودا ولا محروما. اللهم إنا نسألك بأسمائك العظمى وصفاتك العليا أن تبارك هذا المجلس، وأن تؤلف بين قلوبنا، وأن تجمع بيننا على الخير والسلامة والسعادة في الدين والدنيا والآخرة، إنك أنت الوهاب. Ya Allah, ya Tuhan kami merafakkan kesyukuran yang tidak terhingga di atas limpahan kurniaan nikmat dan rahmat-Mu kepada kami semua, sehingga kami dapat berkumpul pada hari yang mulia ini di Majlis Syarahan Kepimpinan Hospital Canselor Tuanku Muhriz. Ya Allah, ya Rahman, kami memohon kepada-Mu, ya Allah, agar Engkau cucuri limpahan rahmah dan inayah-Mu kepada kami semua, dan Engkau berkati majlis kami ini. Ya Allah, ya Tuhan kami memohon dengan nama-nama-Mu yang maha agung dan sifat-sifat-Mu yang maha tinggi, agar Engkau satukan hati-hati kami dan Engkau himpunkan kami semua ya Allah di atas naungan rahmah dan kasih sayang-Mu, serta Engkau kurniakan kepada kami ya Allah keselamatan, kesihatan, kesejahteraan dan kebahagiaan di dunia dan juga di akhirat. Allahumma ya alimal ghaibi wasyahadah, ya Allah kurniakan kepada kami ya Allah kekayaan ilmu pengetahuan dan hiasi diri kami dengan sifat-sifat yang terpuji, dan muliakan kami dengan ketakwaan, dan indahkan kami dengan kesihatan dan kecemerlangan. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azaban nar. Wa sallallahu ala sayyidina Muhammadin wa ala alihi wa sahbihi wa sallam. Walhamdulillahi rabbil alamin. Taqabbalallahu minni wa minkum. Taqabbal ya karim.
Majlis merakamkan ucapan terima kasih kepada Ustaz Hasrizal Hasan. Memulakan atur cara majlis dengan segala hormatnya menjemput Yang Berusaha Profesor Madya Dr. Jamari Sapuan, Timbalan Pengarah Perkhidmatan Serjeri dan Wakil Pengarah Hospital Canselor Tuanku Muhriz untuk menyampaikan biodata pengenalan Yang Berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali dalam syarahan Kepimpinan HCTM Siri kedua sempena Jubli Perak 25 tahun HCTM. Dipersilakan.
Bismillahirrahmanirrahim. Terima kasih Puan Pengerusi Majlis. Assalamualaikum warahmatullahi taala wabarakatuh. Yang berbahagia tetamu jemputan kita pada sesi bicara kepimpinan HCTM, iaitu Profesor Emeritus Dr. Raymond Azman Ali, iaitu Professor of Medicine and Senior Consultant Neurologist Department of Medicine UiTM Sungai Buloh. Yang berbahagia Profesor Dato Dr. Hanafiah Harun Al-Rashid, Pro Naib Canselor Kampus Kuala Lumpur. Rakan saya yang berbahagia Encik Musidi Ahmad, Timbalan Pendaftar HCTM. Ketua-ketua jabatan, pegawai-pegawai kanan HCTM serta para tetamu jemputan, saudara-saudari yang dihormati sekalian. Alhamdulillah pada pagi ini dapat kita bersama-sama berkumpul di Dewan ASSC yang begitu indah ini bagi sesi ceramah kepimpinan sempena sambutan 25 tahun Jubli Perak HCTM. Untuk pengetahuan semua, ini adalah sesi ceramah yang kedua setelah sesi pertama disampaikan oleh Dato Dr. Omar Abdul Hamid pada Februari lepas. Pada hari ini kita berasa amat bertuah dan kita memberi penghormatan kepada Yang Berbahagia Prof. Emeritus Dato' Raymond Azman Ali yang akan menyampaikan syarahan kepimpinan kedua bertajuk Effective Communication. Izinkan saya membaca sedikit biodata Yang Berbahagia Profesor. Beliau dilahirkan di Pulau Pinang, Malaysia. Prof. Dato' Dr. Raymond Azman Ali kini merupakan konsultan neurologi di Fakulti Perubatan Universiti Teknologi Mara UiTM Sungai Buloh, Selangor. Beliau berkelulusan dari Universiti Monash, Melbourne, Australia dengan ijazah kepujian MBBS pada tahun 1984 dan merupakan top 5 student in his class dan second top student di Alfred Hospital. Seterusnya beliau meneruskan pelajaran dalam bidang Advanced Medicine course di National University Singapore pada tahun 1989 dan seterusnya memperolehi master dalam perubatan dalaman dari Fakulti Perubatan Universiti Kebangsaan Malaysia pada tahun 1991. Beliau kemudian melanjutkan latihan sebagai Research Fellow in Clinical Neurology dalam bidang penyelidikan epilepsi dan neurofisiologi di Institute of Neurology, Queen Square, London pada tahun 1994. Seterusnya, beliau dianugerahkan dan telah dianugerahkan ijazah kedoktoran dalam neurologi dari Universiti Monash, Australia pada tahun 1996 dan diikuti dengan FRCP Ireland serta FRCP Glasgow dan FAMM pada tahun 2001. Tesis kedoktoran Profesor Dr. Raymond bertajuk Cerebral Cortical Dysgenesis in Adults with Epilepsy. Beliau merupakan dekan Fakulti Perubatan dan pengarah Hospital Pusat Perubatan UKM, PPUKM pada ketika itu, yang merupakan pengarah yang kelima dari tahun 2011 hingga 2016. Beliau kini merupakan pengerusi Majlis Epilepsi Malaysia dan ahli jawatankuasa kecil Neurologi Pejabat Pendaftar Pakar Kebangsaan. Sungguh hebat Profesor Dato Dr. Raymond kita. Beliau telah dijemput untuk menyampaikan lebih daripada 400 kuliah di dalam dan juga luar negara dan telah menerbitkan ratusan kertas jurnal berkaitan neurologi. Beliau mempunyai H-index sebanyak 27 dan salah satu artikel asalnya dalam Brain Journal telah dipetik sebanyak 475 kali. Pada tahun 2002, beliau menjadi penerima pertama anugerah tertinggi perguruan di UKM, iaitu Anugerah Pengajar Guru Cemerlang. Pada tahun 2009, beliau turut menerima Anugerah Akademik Negara atau Anugerah Guru Terbaik Kebangsaan daripada Kementerian Pengajian Tinggi, menjadikannya guru terbaik dalam sains kesihatan seluruh negara bagi tahun tersebut. Beliau adalah doktor perubatan pertama yang pernah memenangi anugerah berprestij ini. Pada tahun 2012, beliau telah menerima anugerah tokoh penyelidik, iaitu penyelidik teratas pada Minggu Penyelidikan Sains Kesihatan UKM yang ke-14. Pada 6 Julai 2019, beliau telah dianugerahkan Anugerah Pencapaian Sepanjang Hayat oleh Persatuan Neuroscience Malaysia. Seterusnya pada 3 Julai 2020, beliau menerima Anugerah Kecemerlangan Akademik daripada Universiti Kebangsaan Malaysia. Pada 27 November 2021, Prof. Raymond telah dianugerahkan jawatan Profesor Emeritus di Convocation UKM ke-49 oleh Duli Yang Maha Mulia Yang di-Pertuan Besar Negeri Sembilan Darul Khusus, iaitu Tuanku Muhriz ibni almarhum Tuanku Munawir, iaitu Canselor UKM sendiri. Hadirin yang dihormati sekalian, begitu hebat sekali personaliti jemputan kita pada pagi ini, dan pihak HCTM sekali lagi merasa bertuah dan berterima kasih kepada Yang Berbagi Prof. Raymond atas kesudian hadir bagi memberikan ceramah pada pagi ini. Para hadirin diharapkan kita mendapat ilmu yang bermanfaat dari ceramah yang bakal disampaikan nanti. Dengan itu, saya dengan ini mempersilakan Yang Berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali untuk memberikan syarahan kepimpinan beliau yang bertajuk Effective Communication. Dipersilakan Yang Berbahagia Prof.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Good morning. Yang berbahagia Profesor Dato Dr. Hanafiah Harun Ar-Rashid, Pro-Naib Canselor UKM, Kampus Kuala Lumpur, Yang Berusaha Prof. Madya Dr. Jamari Sapuan, Wakil Pengarah Hospital Canselor Tuanku Muhriz, dan juga penyampai biodata saya. Terima kasih. Macam ceramah on its own ya. Dan yang berusaha Encik Mursidi Ahmad, Timbalan Pendaftar HCTM, Ketua-Ketua Jabatan, Pegawai-pegawai kanan kampus Kuala Lumpur, sidang hadirin yang dihormati sekalian. Saya buka ni ya. Boleh. Okay. Terlebih dahulu saya ucapkan terima kasih lah kerana menjemput saya memberi ceramah kepimpinan atau syarahan kepimpinan yang kedua. Dr. Jamal dia lama dah jemput sebenarnya. Untuk saya memilih topik yang sesuai untuk ini ya. So saya fikir yang paling sesuai selepas Datuk Dr. Omar ialah inilah effective communication. Sorry tadi terpicit kot tadi the slide tadi. So allow me to speak in English, Datuk boleh? Ya. Okay, saya cuba dua bahasa lah ya, sebab so to make it easier for everyone. I choose this topic because in management and also as doctors in hospital, nurses, pentadbir, it's very important to effectively communicate so that you get people to understand you and there's better rapport and so on. So I'm going to do it in this talk. First is to define what communication is, and then why is it important for doctors to communicate effectively. What are the general principles of effective communication? Because patients are our main clients in a hospital, so we'll talk about how to conduct a patient interview effectively, how to break bad news. And if I have time, yeah, I will talk about how do I clerk a patient effectively. So this, because I know there are many people viewing this online, and there might be some master students as well as undergraduate students from UITM, so it's online thing. So I will talk about that if we have time. So what is communication? Yeah. So it's a process, yeah, that we relate and interact with each other, with other people. It includes listening, yeah, and understanding with passion and respect. Yeah. So not enough if we just listen but don't understand. That's not good enough. And maybe verbal or non-verbal body language, tone of voice, can be complete silence. Yeah. The best example of complete silence and non-verbal is Mr. Bean. Mr. Bean, very effective communication, but he's an idiot now. So, but we can understand what he's trying to say. So that is example, yeah. And such encounters, yeah, may cover exchanges of desires, which I won't talk too much about, needs, perceptions, knowledge, emotions, views, and ideas. So it covers many things when we communicate with people. If we go back the history of oral communication, yeah, speech was developed, I don't know if it's real or not, but it's about 200,000 years ago. Yeah. Symbols later, 30,000 years ago. And writing maybe about 7,000 years ago. Don't take this for, we don't know how this is what they look at drawings in the caves and so on. Yeah. So this is quite long. In terms of our development, yeah, the pediatricians will know this. We start to make words at the age of 12 months, 1 year old. And at 5 years old, all of us should be able to speak like an adult. Cuma what happens is that we gradually increase vocabulary. Some of medical students vocabulary sama je actually, tak pernah increase. But vocabulary will increase when we listen to people, news, read and so on. So vocab is important after that. Before that, it's just language development. After that, vocab. And older adults like some of us here have difficulty retrieving those words, or to use, or sometimes to understand people. But I don't believe we are in that group lah, yeah, Dato, enough here. So we not yet. And the speech is typically softer, slower. I noticed my grandfather last time memang akan cakap slower lah. Kenapa dia slow sangat, Parkinson ke kan? Actually they're slower. If you know, tell me, those who are above 60 and getting to 60 will notice that. Less fluent and less precisely articulated. Yeah. But it's enough, adequate for communication, everyday communication. So this is, I think you notice some of the politicians, when they go older, it's a bit slower, not as fast as before. I don't show this, but there's a reason to show this. Which parts of the brain, control our speech? Can you see my arrow? Okay. So we listen. So this is the primary auditory cortex. Kita dengar, yeah, and then it's interpreted here, Wernicke's area, yeah, in the temporal lobe or lower parietal, and then it sends a signal to what we call the arcuate fasciculus to the broadcast area to produce speech. This is a simplistic view, but in between, yeah, we are affected by emotion. So when you are sad, the voice may not come out so well. If you are nervous, kadang-kadang kita rasa macam lump in the throat. Tiba-tiba tak cakap. All of you have experienced this. Interview, exam, nak bagi speech macam ni kan, tiba-tiba tak boleh cakap. All these things will influence the ability to produce those words that come out from the mouth. I'll just show you this patient, ya. Dengar cakap.
Tinggal mana?
Tinggal mana?
Tinggal mana? It's counting in Tamil. Tinggal di mana?
Okay. Section.
Okey. Angkat tangan kanan.
Saya tunjuk mana ni.
Ya. Tutup mata.
Dia tak tutup mata je.
Tutup mata, uncle.
Tunjuk lidah.
Close your eyes. Open your mouth.
Show the ear.
Show your ear. Tunjuk telinga. Telinga mana?
See, he's learning.
So this man has what we call global dysphasia. my MO, dia tunjuk tau. Kalau you say tutup mata, kalau you tunjuk, they ikut doesn't mean the speech is okay actually. Because they mimic what you do. You have to go through the ear tau. So, I told my medical officer, you talk to him, don't show, tunjuk lidah, dia pun tunjuk. MO tunjuk, tunjuk lidah. Tak boleh, dia akan ikut. This patient had a stroke involving the middle cerebral artery, big area. So, dia tak faham dan dia tak boleh sebut betul. Even the relative kat belakang tu tak faham apa dia cakap. So it's even in Tamil tak faham. So this thing is because of a stroke. But medical students pun macam ni kadang-kadang. Kita question kan, cakap pun lain, tak faham. I always tell them, you all have global dysphasia. Sebab apa? Sebab dia orang nervous ataupun tak ada benda nak cakap actually. So dia jadi tergagap dan dia cakap macam tu. Okay, so this will show that the anatomical substrate for communication important. You must have that lah. Otherwise you cannot communicate. I don't know whether you know this, but the brain starts to shrink at the age of 18 years old now. I tanya medical students, Dato, Dr. Jamari, I tanya students, how old you think our brains start to shrink? Then they look at me, 60 dia kata. So I'm sorry, your brain already started to shrink. So by the time you enter university, memang dah shrink. 1 neuron per second. So I'm talking about berapa minit dah berapa neurons will die. So the brain will shrink because of death of neurons. But don't worry, we have billions of neurons, and we only use about 10% of the brain. Einstein guna 20% lah. Maybe Dato' Anapi 15% in between lah. So we use about that average 10%. And we have a lot of spare parts. That's why stroke boleh recover, yeah. So the best age to learn a second or multiple languages actually is before the age of 18, but best before 10. Kalau kita nak belajar Japanese sekarang ni kan, jangan harap lah. Kalau susah. You really have to force. Some people have that talent, tapi memang susah. Tapi you notice kan, anak-anak yang kawan-kawan kita belajar kat UK, datang balik cakap macam British. Because they are young. Saya pergi London, cakap macam Malaysian lagi. So it is not, it is more difficult to learn a language when you are older. But some people have this capability of learning multiple languages, 10 languages for instance. They start very young. Okay, so why is communication important for doctors? Firstly, you see, if you don't communicate properly, you will end up with medical, legal and ethical problems. When I was pengarah, there was a case, I don't want to say what case it was, but example, you're supposed to remove something from the right foot, tapi they operated left foot. So then the husband came and was upset. I don't know if I told any of you about this problem. I was the pengarah because the husband came to me and said, saya tak marah dia operate salah kaki, tapi doktor tu cakap, kan bagus, tak payahlah operate kaki tu lagi sekali. Dia masalah kaki kanan, tapi kaki kiri dia operate salah. Then the doctor boleh cakap pula, at least nanti in the future tak boleh operate dah. Oh, so actually the miscommunication dia nak sue, bukannya kaki yang salah. So that's a problem. So you must communicate. I think that doctor is what we call careless, CALLOUS ni, because dia tak kisah lah. Doesn't seem to be that important to the patient. But patients are very sensitive, and relatives especially your wife or husband kan, salah operate, mesti you marah kan. But the doctors must have a way to communicate with this. Yeah, I've got no time to talk about how to communicate that, but this is a major source of problem. Yeah, and also if we don't tell properly, patients may refuse treatment inadvertently or accept treatment. They tak faham tapi accept. So there's a problem. This is not good as well. And I don't know whether you realize the doctors among here kan, I get relatives calling me up, Prof, boleh tak Prof telefon Dr. Jamari? Dia cakap dia tak faham dia cakap. Saya boleh jadi middleman no. Jamari, kau explain apa kau buat tadi. So that means the doctor did not explain to the patient. Dia minta doktor lain, I'm sure you all have come across it, right? Please ring up hospital Kanga. Saya pergi sana, doktor cakap apa benda, cakap tak faham. So we become middlemen because it's not explained properly. And this often happens. So it's a problem. And historically, the medical curriculum, my time especially, hard skills will emphasize soft skills very little. Now it's the other way around. Maybe too much soft skills. I remember Prof. Dato Zainul sini tak ada. He will say, sekarang ni students will present history. This is a 34-year-old mother who is a lovely housewife, a loving husband, all the soft skills tu. Lepas tu tanya diagnosis tak tahu. Dia, the hard skills tak ada pula. So sometimes we have to balance between hard skills and soft skills. And now kan, learning on how to communicate effectively is assessed in exams, MS pun ada exams, and also in the MRCP PACES exam. There's a station specifically for communication skills, because it's disheartening to hear as pengarah or as a Canselor, people don't communicate properly, and you try to solve just miscommunication. It's a problem. So what are the 4 communication skills? We start with listening tadi, kan, kena dengar. There's listening skill, I hate people when you want to say but they stop you halfway. It's exam. Tengah present, my co-examiner stop dia. Tunggulah Ustaz, nanti mungkin dia cakap juga apa yang nak tanya ni. So we have to listen. Speaking, except for Mr. Bean. And then non-verbal skills. Your body language is very important. At interviews kan, kalau you pergi interview, when you communicate with the interviewer, don't swivel the chair kan. Ada student macam ni, interview. Saya tinggal di macam ni, all these things. So the posture. I just had one candidate baru ni kat UiTM. Dia interview for associate professor macam ni, macam ni. So got the dean very distracted actually. Correct, nervous. I come to nervousness later. And then of course the thinking skills. So all these things must work together to be effective communication. So you get a clever person, got all the knowledge, tapi tak gerti nak communicate tau. Ada aja lecturer macam tu. So patient pun apa benda cakap ni, tak tahu. You have a not so clever doctor, kan? Doesn't know what he's talking about. Lagi teruk. This one don't know what he's talking about. Effective communication tak guna juga, You must have content. You must know what the subject matter. Of course, if you have someone who is knowledgeable, effective communication, patient happy. Okay, but there's another situation. Clever doctor, knowledgeable, effective communication, tapi then something wrong with the patient. Dementia ke, ataupun confused. There's a patient factor, depressed. So you must explore that. So there are 5 possibilities when you communicate with people, and particular patients, because you're talking about hospital. So you have this situation kan, sampai the secretary to the GP ni kena bagi dictionary for jargon, medical jargon, because doctors use jargon a lot. Terms yang you all tak faham, yang doctors guna. So macam kucing cakap anjing, itik cakap dengan ayam, kan? So that's a problem. Atau doctors who have no eye contact, kan? Ambil ubat ni lah, tak pernah pandang patient, also it's not effective. Okay. Right. So effective communication will ensure good working relationship with the patient, whoever you're speaking to, increases patient satisfaction, the understanding and illness management, and improve compliance to the treatment. So kalau boleh, if there's time, you should actually plan how you communicate with the patient. Think the outcomes you want, and it's what we call a helical model. So what I say will influence what you say, and then back and forth, it goes up to a different level until you get the final thing that you want the patient to understand and follow in terms of management. Empathy is important, and we have to know how to handle emotional outbreaks, which I'll come to in a minute. So eye contact. This is what I learned. So when I was doing the teaching and learning courses in Bangi dulu, masa Tan Sri Syarifah Hafsah was in medical education. Look at everyone in the room. I know some lecturers kan tengok seorang je, sebab dia yang selalu macam ni kan. So we have to look at everybody. If there's many people in the patient kan jumpa family, look at everyone. Jangan tengok seorang je. So this is important. You must pronounce each word clearly. Kena sebutlah. Some people swallow the words. Saya pun tak tahu apa dia cakap. Okay. As I mentioned, swiveling the chair, jingling the keys kan macam ni, untuk cakap macam ni je. Atau pacing macam ni. Saya kan hari tu kan macam ni. Saya tak I don't like that actually, because it distracts. It's very distracting. I think CEO of Apple boleh lah kot. Dia nak show a product kan, they will do that. Tapi macam doctors who give a talk like this, especially kalau ada patient, janganlah kita pace up and down the room. It's very distracting. Minimize stuttering, yeah, and saying this is difficult. I know I have that sometimes, but I learned this from my supervisor in the UK last time. Kalau boleh we avoid that, but it's difficult. And think what you're going to say before you say it. That's really important. That's what the thinking ni. Kadang-kadang kita cakap je, lepas je, but we never think what is the outcome from that. Ni. Sekejap ni peribahasa sekejap. Kenapa tak boleh main ni. Inilah swivel ni. Tengah cakap kan dengan patient ni, main dengan pensel ni. This is typical. Semua suka buat kan. Masa sorang-sorang boleh lah. Tapi tengah cakap patient, doktor ada buat je tu. Ya, okay. So, terlajak perahu boleh diundur ya. Terlajak kata buruk padahnya. So, it's difficult. Dah tercakap, sorry. But it's too late lah. So, that's difficult. Yeah. So, there's so many people that doctors communicate with. Yeah. I've highlighted the ones that, okay, well, let's see that. So, patients, caregivers, colleagues, administrators yang susah lah untuk Pro Net Canselor dan timbalan pengarah, ya, untuk timbalan pendaftar, ya, nurses and other auxiliary staff, ya, media. Ni saya kat TV ni. Media tu lain pula cakap tu, ya. You must really go down to the level yang public lah, macam public, ya, or attendees of a meeting and conferences, and lawyers. Have you been to court? You have been to court. Semua dah pergi court. Lawyers yang paling pandai cakap lah, kan? Selalu dia menang lah. Kalau cakap, they will win. That's why they are lawyers. And memang I hate to go to court lah. Our biggest enemy is the lawyer. So don't make any mistakes. But I don't know you went as what, but I went as a witness, expert witness. Bukannya kita buat salah kan? So expert witness nak tolong kawan. Rupanya actually more difficult. Got worse. So I will never go again. Okay. So we communicate with patients and caregivers. Yeah, the skill for history taking. I'll just come to that in a minute. Breaking bad news can be difficult, and then how to tell about results of physical examination. Kadang quite bad, the findings, or investigations, prognosis, treatment. That can be quite tough. And obtaining informed consent, research or for procedures, is important. Kena the patients kena faham betul-betul, ya. And for the doctors here, nurses, good communication should be established from admission between patient, family and the multidisciplinary team. Ya, jangan tunggu macam dah the beginning tu macam very what do you call it, impersonal. You have to be from the beginning, kena establish a rapport with the patient. And kalau boleh, masa ward round, get the family and patient and the family involved in the medical care and treatment, yeah, rehab. Masa follow up and masa nak discharge, follow up and readmission plans, and ask them always any questions. I don't know how many doctors do that actually, because it can be time consuming, but we have to do this. So I think we have to individualize the amount and type of information we give to patient. Yeah? Some patients who are very verbose or they think they're clever, you might have to adjust what you tell them. They will fight back. I remember a patient telling me, Prof, your anti-seizure drugs are useless. Garlic works, Prof. Garlic. So the whole interview, actually his treatment or replace my treatment, This kind of patients are difficult. They call it quasi-knowledgeable. It can be difficult to handle these people. You should make the patient feel understood, valued and supported in every way you can. Explain in simple layperson language, This is important. Guna bahasa yang mudah difaham. So I think that's difficult. We test in the exams. Don't use jargon. I think for the doctors and nurses here, so because they have not gone to medical school, and involve the patient in discussion and management plan, and encourage an environment that maximizes accurate and efficient information gathering, planning, and explanation. Do not laugh or whisper. Walaupun you're not laughing at them, Sometimes you're laughing because you found the situation funny or someone was passing by. Don't do that. Don't whisper. Do not assume they cannot speak English. And so this makcik kampung, dia cakap kawan makcik ni dia bodoh lah. Cakap in English, this is really stupid. So, but she understands, address them by name. This is seldom happens in Malaysia. I notice, Dato' Anafia, when in UK and so on, they call by name, Mr. King, Mr. John, misalnya. Here, patient yang sebelah tingkap kanan tu, I think nurses will know kan, doktor tanya mana patient tu, so tak ingat nama. We have to address them by name. Okay. When you consult the patient, this is important in terms of the environment, quiet room, tone of voice, body language I've mentioned. You have to be aware of the patient's emotional state and identify all the problems and concerns the patient has. Kalau boleh, we establish an agreed agenda and plan for the consultation, and enable the patient to become part of the collaborative process. You work together, decide together. And to close the consultation, you have to confirm the established plan of care, clarifying the next steps for both the patient and doctor, the plan B, and also maximizing patients' adherence and to treatment and also health outcomes. You have to make use of your time efficiently. Okay. So, I don't know if you've seen this, but this is called the class protocol when you interview a patient. The acronym is there and those are the words, but I will go by one to save time. So the context, choose a private and quiet room. Maintain eye contact, I've mentioned earlier. No physical barriers between you and the patient. You also must be relaxed. Box of tissue. Tapi jangan letak depan patient macam obvious sangat. Tissue kat sini. So, and do not touch the patient unless it is necessary to comfort them. And of course, if there are cultural differences, we don't do that, touching the patient. I know in the UK they like to touch you. Don't worry, semua they touch. So this can be not so acceptable to certain cultures and religion. Use open-ended questions. Don't ask questions yes or no answer when you start the interview. I mentioned earlier, allow patient to speak without interruption. You don't interrupt them, listen dulu. Nodding along the way to make them know that you understand, and possibly repeat a key word from the previous sentence so that they can go on. So examples, if I understand you correctly, you are saying so and so. And if you know you're going to be called to OT or there's a clinic somewhere else you have to do, you have, let them know early than later so that they know there's a time constraint there. There's nothing worse than looking at the watch all the time. Tengah interview, tengok jam, patient tengok jam, then they don't like that. Acknowledging emotions, identify the emotion, the cause of it, and try to make a connection between the emotion and the cause. So you see things like most people would be upset about this. You do not have to have the same feelings as the patient, right? I mean, patient dok nangis kan, sedihnya saya, you pun nangis, saya pun sedih jugalah. Don't do that. You have to be strong as well, and you do not have to agree with the patient's feelings. You don't have to agree with that. So, place in your mind or clarify with the patient the expectations of treatment and outcome. Decide what's the best medical plan for the patient, and recommend a strategy on how to proceed. Evaluate the patient's response, and we collaborate and agree on the plan and contingency. So that's how we interview a patient in this class protocol. And lastly, the summary. I like to, I don't know what the consultants here do, but in every room in HCTM we have a whiteboard. So I try to draw things, summarize, and then ask the patient to repeat what I said. So we go through one by one. So the patients like this, sometimes dia ambil gambar kan. Oh, doktor boleh tak ambil gambar apa yang saya kena buat ni. So they will improve the compliance to your treatment. And of course you have to ask the patients any other questions they have or concerns. And you can, I don't know how many of you give, I sometimes give my own number, personal number, to patients who have difficult epilepsy or difficult neurological problem. They can message me anytime. Otherwise, you give email if you cannot complete the consultation in time. So that's important for communication. Okay, bad news. This is quite difficult. So bad news is anything which is drastically or negatively alters the patient's view of his future or her future, and it will result in a change of behavior, cognition, emotional state, and so on. And You have to protect patients. You have to balance between protecting the patients from disheartening news versus patient autonomy. Sometimes the relatives say, don't tell my father that he's got cancer. But there's also patient autonomy. So you have to balance between the two. And there's another lecture about that. Clinicians are responsible for breaking bad news, but are not formally trained. So that's a problem. So now we do assessments in our exams with the masters and so on. So that's the spikes protocol for this bad news. This is important. So identify a quiet, undisturbed area. You have to prepare what to say. Anticipate the family reaction. They may be angry. They cannot believe you, and so on. Have all the key people whom the patient wants. You have to ask the patient, who do you want in the room? And the patient should be closest to you. And no barrier between the two of you. And you have to be calm and maintain eye contact. So that's how we try to start off the setting. Ask the patient first. Tell me what you understand about your condition so far, so that you know where to start. And assess the patient and family members' level of understanding. They may got everything wrong. Take note of the discrepancies, the patient's understanding, and what is actually true. The two, are they the same? Sometimes you have to rephrase or paraphrase, and watch for signs of denial. Invitation, ask the patient if they want to know the details of the medical problem. So I like to go through over the results. Would that be okay? So they say, no, can I do it next visit, for instance? Accept the patient's right to know. They have to know all this. You don't keep any secrets about this. You have to be transparent. Offer to answer any questions the patient or family member may have. And you cannot delegate. Saya tak nak, I'm busy lah. Boleh tak minta registrar buat ni? You can't do that. It's your patient, you buat. Okay. Avoid medical jargon. This is K, under spikes ni. Avoid medical jargon. So, example, instead of saying non-toxic multinodular goiter to the patient, you say thyroid enlargement, for instance. Fill in any gaps that were evident in the perception stage, and present the information in small chunks rather than a whole big chunk like that. Okay. And then you ask each chunk, you ask whether you following me or not. So deal with emotions as they occur. Patients who are very emotional will not understand you. They won't understand you if they're emotional. Use both open-ended and now also closed-ended questions. Can you tell me more about your feels open-ended? And did that make you angry? So that's yes or no answer. You can use affirming statements to exhibit empathy. Example, I can see you weren't expecting this. Mentioned a box of tissues earlier and about touching patients if they are emotional. So use statements like, tell me more statements. If a patient say, I don't know how I'm going to tell my kids, you say, tell me more about this. So explore, give them the opportunity to talk first. Try to keep your own emotions in check. There's a 6-second rule, they call it. Kalau you pun tengah boiling sini, dalam your own self, you're angry, you have to kira lah 1, 2, you calm down, then baru you cakap. And don't give false assurance. Everything will be fine, don't worry, salah. I've seen lots of miracles happen for bad news. Cancer of ovary stage 4, katakan. Miracles happen. So that shouldn't do that. You should set an example. Don't ask patients to calm down. You have to model calmness. Listen to the needs and concerns of expressed expectations. Use the words like to help patients settle down. Don't argue with the patient, and say no in a tactful manner if the patient request is unrealistic, or the demands are unrealistic. So these are some examples you all can use. I mentioned that I can see you weren't expecting this. This isn't easy to talk about, is it? It's very, very stressful, isn't it? It must be hard to come here every week and follow up. I can see how difficult is it for you. I wish we had a more effective treatment. So these are some examples you can use. Rather than phrases like this, I know how you feel. Actually, you don't know. I feel your pain. It's going to be all right. Just relax, everything will be fine. I feel your pain, the most dangerous one to use. They will say, you don't know my pain. So you shouldn't use such things like that. Again, the closing similar to tadi. Decide on the best medical plan for the treatment for the patient. clarify with the patient the expectations of treatment and outcome, recommend a strategy on how to proceed, collaborate and agree on the plan, ask the patient to repeat to you the understanding of the plan. So ulang balik what they know. And then write down the treatment plan clearly for the patient to take home. So either the whiteboard dia ambil gambar or on a piece of paper and write clearly, please. Okay, so be prepared for tough questions. Does this mean I'm going to die? So you respond by saying, tell me more about what concerns you. Can I be cured? Yeah? So I'm so sorry to say that it is unlikely. Our goal is to keep it in check. Yeah? How long do I have to live? So again, you have to open up and say, I can discuss that with you, but first tell me why you asked this. So these are some examples of responses which will comfort the patient. Okay, I just go to the last part, yeah, Jamari. So I just show this selalu to my students and the TOT, yeah, for young lecturers. When you see a patient, yeah, I employ my philosophy, which is when you see a patient, you're a detective, yeah, because you have to explore everything about the patient's problem, and then when you present or discuss the patient, you're a lawyer actually, and a doctor when prescribing or formulating a treatment plan. So a doctor has 3 jobs in one, yeah? Detective, lawyer, and doctor. A medical lecturer has 4 jobs: detective, lawyer, doctor, teacher. Okay? So why detective? Because history taking is in interrogation. It's like KGB, CIA. It's the investigation of the where, what, why, and how of the patient's problem. To answer the question, who's done it? Basically, kalau as a detective, and who murdered that patient. You have to explore all possible explanations for the patient's complaints. If you don't, you may go to court. That problem you tak explore, that's the problem, the diagnosis, pergi mahkamah. You might lose your license to practice. So the peribahasa in English is, do not leave any stone unturned. That's what detective. Why lawyer? Because you're going to present all the evidence derived from the history and examination to defend your diagnosis. As students who can defend the diagnosis well, I'll give them a distinction, very well. The way they give all the evidence for that diagnosis, even though it's wrong, but they defend it well. I know one candidate masters who gave the wrong diagnosis, but that's what the patient gave, and he got a distinction for that. The diagnosis is totally different, but the story was like that diagnosis. He's now a professor of neurology, actually. Okay. So what we do, when you take a history from a patient, you greet first. You must appear interested and sympathetic, yeah. Kalau you pun boring, tak ada eye contact, susah. Introduce yourself, state the purpose of the interview, and you start with open-ended questions like just now. Yeah, how can I help you? What seems to be the problem? When were you last well is a good one. Okay. So, when you take the history of a patient, riwayat pesakit, you have to show interest and empathy. So things like, I see, I understand what you mean. That's clear, please keep talking. And do not repeat the same question if satisfactory answer is obtained. This is very common in doctors who don't pay attention. No? Makcik cakap apa? Kan saya dah cakap tadi, saya tak ada sakit dada. So they get upset. So you have to listen carefully. And avoid leading and biased questions. Especially kalau younger doctors, the older patient will kesian the younger doctor. And dia setuju semua. So makcik pengsan itu 3 minit ya? Ya. Dia actually tak fikir pun. Dia just cakap je tu je. So it's like you're leading. You already gave the answer 3 minutes. So that's not good. Eye contact I've mentioned. I've mentioned about looking at the watch as if you are in a hurry. But what you should do actually is make the patient feel that he is the only patient today in the clinic or in the ward, as if you have an indefinite time period to interview him. I don't know if you noticed it, but when you go to see a doctor, a good consultant as a patient you all, they are relaxed and they treat you as though you're the only patient that day. You feel you dah cure dah, 90% dah baik dah. Avoid writing as you listen. Yeah? Don't look like a reporter. Short nose encouraged, but pergi GP kan, yang pergi buat medical check up, doktor duk tanya tapi tak pernah pandang you. So because nak sibuk nak tulis. So this is not good. When you examine the patient, I tell my students that you can still examine can still communicate with the patient. So example, if you examine the abdomen or a joint, let me know if I hurt you, rather than do you have pain anywhere, and leave it at that. I don't know whether do this or not, Dato and Dr. Jamari. Students like to ask, sakit mana-mana tak? Actually, I don't like that because sakit mana-mana, then they start holding patient. Aduh, sakit. Makcik kata tak sakit. Mana-mana. Tu lain doktor. Makcik boleh jawab tak? Saya tak sakit. Doktor touch tender, doktor. So there's a difference between pain and tenderness. Students get confused, you know. Ada sakit mana-mana is pain without touching. Tak ada, tak sakit. The minute they touch, dia jerit. Dalam exam fail lah kalau jerit. Because the correct way is to say, let me know I've heard you, and be gentle for every part you touch the body kan. So give instruction rather than asking the patient where you. Ni masa examine tau, bukan masa history taking. History taking tanyalah, do you have pain anywhere? Dia kata tak ada. Masa examine, let me know if I heard you. It's better, yeah. So best to continue history taking of standard questions while examining the peripheries and abdomen. Mana-mana yang kita boleh cakap sambil memeriksa, like looking for clubbing, abdomen. In fact, when you talk to patients while examining abdomen, they're more relaxed. You don't. Otherwise, they focus on. Dia cakap dengan dia. Do you smoke? Dia relax sikit. Do you drink alcohol? That's better. And demonstrate compassion and caring attitude all the time. Yeah. You must smile confidently, not smile stupidly. Yeah? Smile confidently. So this is important for the patient to relax. Yeah. So what doctors often do when ambil riwayat pesakit, the pesakit comes to the problem. The problem example is chest pain. I always take chest pain example. This is probably the most common medical problem in emergency department. What the young doctors will do, they only think of symptoms pertaining to myocardial infarct. Sure punya, yeah? Breathlessness, palpitation, sweating and vomiting. They are unable to expand on history. They cannot do a focused physical examination which is guided. They miss important investigations and they do not know how to comprehensively manage the patient. This is what I give all over the country, how to take a history. This is my way of doing it. So patients do not present with diagnosis. They come with a problem. So example, severe chest pain. So what we should do actually is to think of differential diagnosis first. Betul tak, Dato' Anavia? Yeah, think of that. I mean, surgeons and physicians should be the same. Because by doing this, then you can expand on history. If you didn't think about aortic dissection, which is surgically and medically relevant, you wouldn't check all the pulses in the lower limbs. You wouldn't ask the patient if the pain radiated to the back. If you didn't think of pericarditis, you wouldn't ask the patient to lean forward. You'll get better. You didn't think of pulmonary embolism, you wouldn't ask the patient, did you travel from London recently, long distance on economy class? Because that is a risk factor for pulmonary embolism. Kalau you think of myocardial infarct, you won't ask those questions. And then so you will know how to examine, you will know how to investigate the patient, and you know how to comprehensively manage the patient. So that's how we should think when you take a history. So saya fikirkan average doctor ni macam robot. Kita bagi dia raw material kan, history, dia keluar raw material balik. Tapi ada label lah, diagnosis. This is what students do lah, kan? They regurgitate whatever the patient said and come out with a label. What it should be kan, doctors kan, HCTM ni lah, should be a super doc. So dapat raw material, proses semua kan, proses, keluar consumable product. Cantik. I don't want to hear the same things that the patient said, keluar sama je. This is the best student or the best doctors. When they present in a conference, they summarize everything and everything is all in a package, nicely packed. Yeah. Okay, that's all. I think. Thank you very much for your attention. Okay. Any questions? I was told that apa ni juru acara tak payah datang. You ada soalan? You pergi sana. Okay.
Thank you for Raymond for a very great talk. I ada satu soalan. If you notice, Prof, ini from my own experience lah ya. Bila kita pergi shopping mall, kita tengok parents tolak baby on stroller. As young as 2 years old, they already holding either phone, smartphone,
right, yeah.
or bigger child iPad. And I noticed from my own experience when I was eating outside. Beside me, there's a table of family with small child, and the child is crying. what the mom do is just give the iPad or
Diam.
smoke, dia diam.
Yelah.
So my question is, how do that will affect the brain development of the child? And my afraid is, in future, 20 years from now,
Yeah.
this generation, we do not have the skills in communication, because they are trained from lahir saja, they are all without communication.
Betul.
Even in the family, at home also, I realized, maybe you all have the same experience, we communicate less, but we text a lot.
Betul.
Even phone line provider pun, kalau you perasan, dia akan bagi free je. If you want to call, free, because they know we less call now, but they charge you for data, because they know that you use WhatsApp more, Insta, whatever, that then you call, we really communicate. So my question, what will be the effect of the child brain, because they from birth they does not train to communicate? That's my first question.
Oh, banyaknya.
My second question, based on your first slide, you see, you show how last time Red Indian use smokes
Yep.
as a way to communicate.
Uh-huh.
And now, as you can see, we use WhatsApp, whatever, also a lot of symbols. So are we going back to the era, Prof?
That's
My
a joke
second
about,
question.
There's a joke about that actually.
Thank you, Prof.
Okay, thank you for the questions. So that baby that kept quiet is that smartphone or tab becomes a pacifier rather than, you can maybe better, I don't know. I think the effects are already seen now. It's not in the future, you know. I don't know, you all experience the first year, second year medical students that tak communicate as well. I know, I'm seeing that now as the students like you know before kan, they do not communicate that well. In fact, there are so complaints about exams, tak gerti nak ambil history, tak gerti nak present. I think it's happening already. What the effect on the brain, I think has to be studied lah, you know, how it affects the brain. But you all know kan about screen time, that's not good. Daripada kecil tengok TV pun tak boleh, Dato. Apa ni, mak marah dah. Apa depan TV dekat sangat ni? Jauh sikit. Tutup 1 jam je. So now kan mak pun tengok juga handphone. So it's becoming, but you must balance kan, because handphones have advantages, so many advantages kan. Saving lives and getting, you know, on call very fast, yeah. So it's a balance between the good and bad lah of smartphones and so on. I was wondering kan, how did we survive last time without a smartphone? We survive kan? Dulu tak ada Waze pun survive. Boleh pergi Melaka, masuk Bandar Hilir tu, sekarang lagi sesat. Sebab dah tukar semua one way kan. Tapi dulu senang je. Tanya orang, pakai map. Handwriting has deteriorated for sure. Doctor's handwriting is very bad now. I get referrals, Dato, for neuro dekat UITM. I say the handwriting looks like EEG lah. Memang tak nampak apa benda tulis, apa tak tahu. Sebab dia orang guna, they will type in the thing and so on. So it's deteriorating. I think we have to look at the big picture. Now medical notes, your EMR kan? Itulah UiTM 100% now. It's because they started later kan. So there's so typing skills now come in more than writing skills. But I agree with you that the smartphone, I think too young at age, you have to control the amount of time exposure kan to these phones. It'd be interesting, be good study jadi. Tapi siapa nak fund that study, maybe Samsung good, or you know what is the long term effect on children's and you said social media, the communication sekarang ni kan becoming sophisticated, all the symbols, shortcut symbol macam ni, all these things, shortcuts. I think it's a balance to between those two. The effect in the brain, I'm sure there's an effect on the brain. Brain kan must have stimulus, then we learn kan. If we don't put a stimulus in, you won't ni. So speaking to your friends, listening skills tak ada dah sekarang ni kan, because you say at the dinner tak ada cakap dah, semua tengah text. Nanti ada exam semua macam tu je, masa nak viva nanti tak boleh cakap. It's a bit dangerous lah, I think. So I'm sure you all have children and dengarlah apa Dr. Jamali cakap, jangan apa ni expose them to smartphone, tab too early or too long per day. Kena control lah. I know some parents memang strict kan. They will hide, they will keep, and the children will follow. 1 jam je, 8 malam, 9 malam, lepas tu tidur. Betul. Tak ada, you buat tak je? Siapa buat? Ada yang buat, ada yang tak ada buat. Can be difficult, I know. Semua nak handphone, and lebih canggih pada kita kan, the younger ones. So unless anyone else got any comments about this, but I think it will be a good study. I think maybe it's ongoing already, for smartphones and the effect on the brain. Lagi satu, smartphone is electromagnetic ni kan, signal. You can damage your nerve, ya. If you lama sangat panas kan phone, then it's dangerous for you. So gunalah Bluetooth or wire for long chats on the phone. I think that's all I can say for now, because we don't have strong data kan on this. Yeah, and we only have until 18 years old kan. Lepas tu brain dah mula mati dah. So we have to start early and get our kids exposed earlier. Any other questions? Saya diberitahu 2-3 soalan je. Oh, ada soalan ni.
Kena pakai mic ke? Tak perlu kot, saya rasa. Datuk, Datuk ada
nama introduce.
Saya student.
Student. Ex-student saya.
Datuk, tadi ada contoh berkenaan dengan nervous. Tapi Datuk tak ada huraikan sedikit pada di hujung dia.
Apa dia?
Berkenaan dengan nervous.
Oh, nervous. Ya.
Sebab macam ni lah, I just sharing with you lah dengan few friend kan. Actually when we start present something to the board ke ataupun start present something lah, saya always nervous in the first 5 minutes. And then I share it dengan the other person pun sama. Banyakkannya nervous. Is it dia ada kaitan dengan kita punya neuro ke? Adakah dia boleh dihilangkan?
Boleh.
Sangat nervous ni.
Awas,
sebab saya rasa saya dah cuba berpuluh tahun dah. Tapi until today saya rasa tak ada excellent lagi yang
nanti saya akan bagi appointment dia.
Itu saya dah, Datuk. Sebab memang itu menjadi masalah kepada.
Tapi you're not alone ni. You're not alone, Cik Ali. Sebab ada one minister tau jumpa I won't tell you who it is. Dia macam tu juga. Nervous, dia cakap. Nervousness actually is good, Cik Ali. If the adrenaline that drives you make nervous kan, makes you think better actually. Kalau you ambil ubat nak kurang nervousness, terus lah tak boleh think langsung. So students yang ambil propranolol or benzodiazepine untuk exam, they don't do well. Nervousness drives you to think actually. The adrenaline increases your IQ. So don't worry. Tapi takut you tergagap, is it? Or cakap? Tak boleh cakap? Ini kena jumpa nyuruh ni. I think you come down and then think before you say it, It's okay, yeah, you do slowly, we'll be okay. I always tell my students, kalau you're nervous, you will start using your brainstem lah gitu. Atau spinal cord. Dia tak fikir dah. It doesn't go sampai sini tau. Tak sampai ke cerebral cortex. Memang tak ada, dia bypass. Dia terus keluar macam tu je. So you have to come down and then pause, tak apa lah. I think it's better to pause and think rather than just keluar hijau patutnya merah kan. You do that, yeah. Tapi for you, speech therapy can help actually. Language and SLT kan, speech and language therapist can help that also. That minister was referred there. Boleh. Ada lagi otak tu. Ada lagi.
Tapi kalau saya boleh share sikit Datuk dengan izin untuk Encik Ali, how the tips to reduce your nervous anxiety. First, kalau you ada rostrum, you pegang on the rostrum punya side. Second thing yang saya amalkan sampai sekarang, you imagine this hall is kosong, tak ada orang. That's my tips to minimize. You just imagine you talking on your own, tak ada orang dalam dewan ni. Itu tips je lah, I don't know, maybe it works, maybe it won't.
Tapi Adli bukan kat meeting juga meeting yang bukan macam ni, just meeting with board, is that right saying? Dua orang je?
Actually itulah. That when we have to present something lah, actually dalam board ataupun dalam komiti kan, the first 5 minit tu memang saya betul-betul jaga sebab saya memang ada something yang tak kena. Dan I always share dengan macam friend juga yang selalu present dalam board semua kan. So, kebanyakannya memang macam tu. Sebab actually we never expect apa yang dia orang akan tanya balik. Kalau kita tanya dah along the way after 10 minit, meaning kita dah ready. Tapi bila kita present first slide pun dah terkena tembak, then problem.
So it's a bigger crowd. Kalau one to one tak adalah, no problem.
Tak ada.
So jumpa Dato' Anafia seorang-seorang je lah nanti. Nanti. But you're right, if you anticipate the questions, like exam kan, you perform better. Saya selalu cakap student kan, betul tak SPM kalau soalan bocor, you perform better kan. So ni bukan soalan bocor lah untuk macam board meeting kan. You anticipate. Anticipate is the same intelligence really. Anticipation. So I tell my student kan yang clerk patient for present the exam long case kan. You anticipate the soalan, bukan setakat treatment semua kan. What questions could he ask me? Saya dah prepare dah soalan jawapan untuk those questions. Nanti kita bincang lah dekat klinik. Nanti tak ada. Ada lagi soalan? Tengok MC time okey kan? Okay, alright. Belum masak kan? Tak nampak lah.
Syarina tu.
Setelah tak ni kepala dia.
Oh ya ke? Cik Z tunduk sikit. Okey, terima kasih Tok atas perkongsian yang sangat bermakna semua soalan. Sebab sometimes kita galakkan patient untuk involve and engage masa discussion. Tapi sometimes kita juga untuk setengah pesakit, mungkin mereka takut sebab bila mereka bersuara lebih dan menyatakan hasrat mereka, ada juga yang rasa soalan macam nanti mereka akan dilabelkan sebagai difficult ataupun cerewet dan mereka mungkin takut jeopardize treatment mereka sendiri. So macam mana Dato' rasa kami kita sebagai professionals akan encourage the engagement tanpa menyebabkan patient rasa mungkin itu akan menjadi disadvantage pada mereka later.
Okay, you should get them engaged 100%. I always say customers always right. Dia rasa macam menyampah banyak soalan. Don't worry, don't have that feeling. Kita biar dia cakap je. I know there's a lot of patient kita menyampah. You know, but customers always right. We always treat them with respect and tak apa, biar dia macam ramai yang menyampah tapi there's still our patients. Saya ada je patient kan tu kan. I know sekarang ni kat our klinik kat HCTM kan kita boleh jalan kat belakang. Ada patient masuk belakang terus, Prof jumpa saya dulu kan. Actually dah queue panjang lagi and then soalan banyak betul kan. But it's okay. Customers always right. So until proven otherwise, I always tell them, dia kata ubat ni bagus untuk urut tu bagus untuk saraf ni kan. Dalam hati kita bodoh je ni kan. Tapi actually what we say, yeah, okay, let's go through this, you know, talk about this, macam tu lah. Any more questions? Kalau tak ada, saya tak datang lagi ni lepas ni. Not this year, I don't think so. Belum lagi. Clear. Okay.
Majlis merakamkan ucapan terima kasih kepada yang berbahagia Profesor Emeritus Dato atas perkongsian ilmu sebentar tadi. Mohon yang berbahagia Profesor Emeritus Dato untuk terus kekal berada di pentas bagi acara selanjutnya. Sidang hadirin yang dihormati sekalian, sebagai tanda penghargaan dan terima kasih, majlis dengan segala hormatnya mempersilakan yang berusaha Profesor Madya Dr. Jamari Sapuan untuk menyampaikan cenderamata kenangan kepada yang berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali. Dipersilakan. Majlis merakamkan ucapan terima kasih kepada yang berbahagia Profesor Emeritus Dato. Sidang hadirin yang dihormati sekalian, dengan selesainya acara penyampaian cenderamata sebentar tadi, maka berakhir sudah majlis syarahan kepimpinan Hospital Canselor Tuanku Muhriz siri kedua sempena Jubli Perak 25 tahun HCTM. Majlis sekali lagi merakamkan ucapan setinggi-tinggi penghargaan. Terima kasih kepada tetamu istimewa kita yang berbahagia Profesor Emeritus Dato Dr. Raymond Azman Ali di atas kesudian berkongsi ilmu dan pengalaman bersama-sama kita pada hari ini. Kita berikan tepukan penghormatan kepada yang berbahagia Profesor Emeritus Dato. Majlis turut merakamkan ucapan terima kasih kepada yang berbahagia Pro-Naib Canselor Kampus Kuala Lumpur dan Dekan Fakulti Perubatan serta hadirin sekalian yang setia bersama hingga ke akhir acara. Sekalung tahniah dan syabas kepada pihak penganjur yang menjayakan program pada hari ini. Sebelum bersurai, majlis mempersilakan yang berbahagia Profesor Emeritus Dato bersama sidang hadirin untuk sesi fotografi dan seterusnya menikmati jamuan yang telah disediakan di ruang legar. Sekian, wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.